rep. I cover Oregon border all the way to Bakersfield, so I have a lot of accounts down here all the time, but I'm here because I wanted to just do a review of our products so that you can get any questions you may have answered about the products, and also just to kind of review how they're used, because I think some of them you may be using a little bit differently than you did in the past. Okay? So the first thing I want to talk about is our frozen antibiotics. These are products you may or may not have used in the past. I'm not sure who your service provider was prior to Pharmacy Care Concepts. Do you know which pharmacy it was? Okay. Anyways, the products are what they are. It's a frozen antibiotic. We make it in Illinois. It's frozen on site to like 20 degrees below Celsius. I mean, so it's really, really cold, lower than your average refrigerator that we all have in our homes. Sent to the pharmacy, frozen. Pharmacy receives it frozen, stores it frozen, keeps it frozen until they're ready to distribute it to a particular patient. So they will thaw it out, then label it with each individual patient's name and information, refrigerate it, and send it to you refrigerated. So it's going to come to you as a product that is specifically for a specific patient with the label on it. If for some reason the patient is just discharged or goes back to the hospital or something and the product isn't used on that patient, it may be able to be returned. So you would contact the pharmacy, and a lot of that is going to depend on the information on this chart. And this is why I want you to have this information, just so if there's a question that comes up. Each of our antibiotics has a different stability, both like the time that it can be kept either frozen, refrigerated, or at room temperature. So some of them have really long room temperature. They can go 3 days at room temperature. Others can only go a few hours. So I give these charts so that you can put them someplace in the bedroom and keep them just for reference in case a question ever comes up somewhere in the future. Also, you can always call the pharmacy and ask these types of questions. Okay? So just so you know, that this is information that we have there, and you will not see this product in the Cubex. It will only be sent to you with a specific patient's label on it. The second product I want to go over with you is our Mini Bag Plus system. You may be familiar. This is what it looks like before it's docked, and I have one friend here we played with and used earlier. So I think most of you have probably seen Mini Bag Plus before. We're going to do a quick review. The first thing I want to review is we only make 4 sizes of the diluent bags. So it's the bag with the attached vial adapter on it. And that's, we make normal saline and dextrose in 50 mLs and 100 mLs. So if a drug has to be diluted in a larger volume, we have to use a different system. Those are the only sizes this product comes in. Okay? Second thing is, when it comes to the pharmacy, it comes in a package like this, a 4 in a package. So we're not going to keep it in Cubex, because once that outer package is opened, it's only good for a certain amount of time. If you open the package, then you have to date it and label it, and it's a lot of hassle. So again, this product will only come to you labeled for a specific patient, and it's going to come as a kit. You will not be getting them docked like this. You will actually be getting in a bag the diluent bag and the vial of medication, and possibly a tubing set. Okay, so that it'll come as a kit for a specific patient, and we'll just dock it and put it together. And we have really nice instruction posters here that have sticky on the back. You can hang them on the wall in the bedroom or someplace, so that you can reference those if needed. Now, the first and most important thing about this is anytime you pull something out of a package to use for a patient, you want to make sure everything's intact and there's nothing that looks like it was tampered with or broken or isn't working correctly. So we recommend squeezing our bags just gently, making sure there's no leaks. Okay? On your vial of medication, you obviously confirm that it's the right medicine. You're going to flip the top and clean the top per your protocol here at the facility. You're going to put it on a stable, solid surface. When you assemble, you need to do this in an area that is considered a medication preparation area. So it's got to be a clean area that's designated for that. So you can't do this on the conference room table. You can't do this where you eat lunch. It has to be in a designated medication preparation area. That will keep you out of trouble with the regulatory bodies. Okay. After you've cleaned the top, you're ready to open your vial adapter. So you just peel that off. Don't want to touch this, it's considered sterile. So you want to hold your vial and at a 90-degree angle push straight down until it clicks. Okay? Once it's on, it's very hard to get back off, but it will wiggle. That's normal because these have to fit different manufacturers' vials, and sometimes they're a tiny bit different. Okay, so once it's attached, attached, this is considered docked. You can leave it this way for your shift. So if you wanted to go in and prepare your meds first thing in the morning, you could do that and just leave them, or you can do them when it's time to administer. It doesn't really matter. You leave it though in the docked state until you're ready to hang the medication at the bedside. When you're ready to hang the med, then you need to activate and mix the med. Most of the time when we're using this system, it's because the meds aren't stable mixed for any length of time. Okay? So you want to just activate it right before you're ready to give it. To activate, you break the seal, this blue seal, by bending it 90 degrees in both directions. Okay? Once you do that, your fluid should flow very easily with a little squeeze into the vial. Only fill it up about halfway. Agitate or stir, mix it up, turn it over, squeeze air into the vial, and let the fluid flow back, squeeze again, repeat the process till you get all the liquid out. And then in the case of my sugar vials, sometimes it doesn't always mix, and you gotta do it again. It just does, it sometimes takes a couple times of diluting. Some drugs are easier than others. But you wanna make sure that you've definitely got all the powder out of the vial and mixed. So take a good look at it. It is okay if there's still a drop or two of fluid in the bottom of the vial. That's normal. Okay? Once it's mixed and all the drug is in the bag, you're ready to administer. So you just pull your blue, spike as you normally would, and hang your medication and administer. Okay? Any questions? Pretty simple. Okay. So that's Minibag Plus. So again, I have a couple of folders with the posters. The next one I have is our VialMate. Now this will be in the Cubex. Okay? You'll also probably see it sent to you labeled in the bag as a kit, again with all the pieces for specific patients. But it is the one product that you're going to see and use most often to give the initial dose of an antibiotic to a patient that's started on therapy. Okay? So you have your vial of medication, your VialMate, and then you have a diluent bag. It can be used on multiple sizes of bags. So 50 ml bags, 100 ml bags, 150s, 250s, 500s. This is designed to be used on any Baxter bag. Okay, so if you try to put it on different manufacturers, you may have a little bit of difficulty. It may not work at all. Just keep that in the back of your head. Okay, so again, we have a instructional poster to reference. Just a little bit of information about the product here. Okay. So the VialMate products always come like this in a nice little package. The top of the one end is sealed. The bottom on the vial adapter portion is not, so leave it in the package until you're ready to use it. Again, you're going to start with your vial, prep your vial, clean the top as you would any other medication. Then you're going to open your bag. Very easy, just pull down the side and pull out your bag. And you want to test the integrity of a bag always when you pull it out of the package. Make sure that it's not leaking, nothing wrong with it. If there is a little bit of fluid, a drop or two of fluid on the outside of the bag, that's normal. That happens during the sterilization process. These bags are always put into an outer wrap because the PVC in this actually allows for evaporation over time during storage, and whenever they also run them through the sterilization process. So a little bit of fluid can sometimes evaporate out and it's caught inside the bag and you'll see a little bit of dampness in there, and that's normal. It doesn't affect the product at all. All of our products are labeled with a lot number, a date of expiration, the product name, the size, and they all have a white barcode on it. The white barcode is unique to Baxter, but it works really well if you're barcoding on anything. And just want to make sure the bag is intact and there aren't any issues. If you ever have a product issue with any of our products, you want to let the pharmacy know right away. And the first question they're going to ask you for is the lot number, which is why I point out lot numbers on the bags are always at the top. The lot numbers on these are down at the bottom. That's how we trace product back to where there's maybe a manufacturing problem or an issue. Even with transport and everything, everything's lot number coded and followed. All right, once you've taken your bag out and you're okay with everything there, you want to open your VialMate, pull it out. Don't touch this side, okay, because it's not sealed. And after you've cleaned this, again, same process, 90-degree angle, just push straight down and it clips on. These fit a little different and they don't wiggle at all. They clamp on really tightly. Okay? Once you've done that, you take your bag and clean your medication port. And you're gonna wipe that according to your policy. Peel off your silver tab. And then we're gonna attach. So you just push it in, and you kind of have to hold close to it to get it started. Once it's started, keep pushing it in all the way until the bottom of the flange touches the bottom of the bag. So these two things should be touching. There shouldn't be much of a gap there. Okay, just keep pushing it all the way in. If you don't push it in all the way, then when you pop the two pieces together, it won't always activate. Okay, so once you're attached, you're not done. This is considered docked. Okay, so to activate on the Mini Bag Plus, we just broke the seal, right? It was simple. This is a little bit trickier because you have to align up the two grooves. If you look closely, they're not aligned. There's about a 1/16 of an inch or 1/8 of an inch between them. So if I try to push this together, it's not going to go together. Okay? You have to turn it just a click. There it goes. And then it'll push right together. That's the step a lot of people forget, is turning to make sure those are lined up exactly. I can't get it to work. Okay? That's why. Once it's together, then it should work, no problem. Okay? So you just squeeze again, agitate, mix, turn it upside down, squeeze the air back in with the product. Drug flow back into my bag. Repeat, because my sugar doesn't mix on the first time. When you fill, remember, only go halfway. If you go too high, it's harder to get it back into the bag because there's not a lot of air space. Alright? Again, there'll be a few drops that don't go all the way through. That's okay. You're ready to hang. Okay? Just pop the glue off and spike your bag and you're good to go. Any questions on how to activate and make these work? Hang your posters just to remind yourselves. Clean the room. The last thing I want to cover is a couple of things with the pump. It's my understanding that you're familiar with the Baxter Sigma Spectrum pump, correct? Because I've seen this before. I'm going to turn these so you can see better. Everybody can okay. So this is our pump, and these were purchased and drug libraries loaded specifically for the Stockton PCC pharmacy. So I want to show you how to get into the drug library and use that, okay? So you always turn your pump on, push the on-off button once. It goes through a little testing process. When you push buttons on this pump, it should beep. And when you turn it on, it should beep and make noise, right? Every time you push buttons. If it's not making noise, there's something wrong with the speaker. It happens. It gets sprayed to be clean. Things don't work correctly. Something's gone wrong. You want to send it in for service. You don't want to use it because if the speaker's not working when you push buttons, it's likely not working when it alarms. So the pump will still alarm and stop, but you'll not know it because you can't hear it at all. Okay. So as soon as you turn it on, the first thing you see is the word Stockton. That's your drug library that you need to go into. So you hit OK, and that takes you into the library. So the next thing you're going to do is enter the name of your drug. Okay. So when you're trying to figure out what do I put in, because sometimes things are called by two different names, right? We know generic names and we also have brand names. Always look at your label. Whatever the drug is labeled on the bag should be what you find it on in here. Okay? So if it's labeled Ceftriaxone, then look for Ceftriaxone, look for a brand name. Okay? So we're going to play with this a little bit, and I like to use Vanco as my sample. So we put VA in. You just need the first two letters of the drug and you're going to get a list. Now vancomycin, if you guys look closely, there's about 6 Vancos listed there because they give you different infusion ranges. So you have to look at your label again and how many grams am I giving here and pick the one that's in the range. So I like to use the 1 gram as a nice example. So I'm just going to roll down to vancomycin 1 gram and hit OK. Now it's asking me a second question. And this is it in 250 mLs or 200 mLs? Okay, now the reason it asks that is very specific to what's going on here. If you are mixing vancomycin this way, using Violate, it's going to be in a 250 ml bag. If it has been sent to you labeled by the pharmacy in a frozen premix, those are only 200 ml bags. Read your labels, okay? Make sure you know what you're doing. Stop. It's asking you questions for a reason, okay? So stop and take the time to look. We have a 250 bag, so we're gonna just use our down arrow and scroll to the 250 bag and hit OK. And then you're gonna get a yellow confirmation screen. These are stops. These are, hey, stop and double check because we don't want you to make a mistake. Okay, these are built into the drug library. That's why it's called a smart phone. So you're gonna say, yes, I definitely want to use the 250 ml bags. That's what it's asking me. And then you can continue with your setup in the normal way, okay? Is there any questions about that? This pump's really user-friendly, very simple to use. We can review putting a tubing set in if you all want me to, because I know you don't use them a lot.
Can you give them an example of a medication preparation service?
A med cart, or in your med room, if there's a counter or table that's the designated area to clean, to prepare medications. It needs to be a clean, designated area that your facility has to prepare medications.
Inside your med room or on top of your med room?
I think that's your best bet. You just want to stay out of trouble with the regulatory bodies because they're not designed to just be made anywhere. They're designed to be made in a clean, designated space.
Not the nurse's station. Try that.
Should be a medication prep area in every facility. Okay, so I have a bag of Mako, pretend, that we have already spiked and gotten the air out of the tubing. I just want to walk through doing this because this is the one thing that, if you haven't seen this pump before, it can be a little bit confusing. To open the door in the pump, you have to have the blue clamp, okay? And it only goes in one way. It doesn't go in, you just put it in the way it fits. When you push it all the way down, voila, the door pops open. So when you do that, it will automatically turn the pump on if it wasn't already on, and it gives you this little step-by-step how to put the tubing in. So you start at the top and just push the tubing down at all the different checkpoints. They're labeled, see the 2, 3, 4. And as you finish them,